welcome to another episode of our injury prevention series. This month we're focusing on baseball pitching and throwing injuries, and I've been lucky enough to get Dr. Jonathan Hersch to join us today. He's an orthopedic surgeon here in Boca Raton, and we're going to discuss, we're going to really focus on youth all the way through teen into college. Obviously professional baseball players deal with this as well, so everything that we talk about today you can apply to that. But we're getting a lot of parents concerned with shoulder, elbow injuries and things of that nature, so definitely was the precipice of starting this conversation. So I wanted to welcome you here today. Tell us a little bit about yourself and we'll dive into it.
Thanks, Kevin. So I'm an orthopedic surgeon. I specialize in sports medicine. Shoulder and elbow is certainly part of my specialty. I've been in practice about 20 years, take care of a lot of overhead athletes, so a lot of this really can be extrapolated to tennis players as well as baseball players. The overhead athletes suffer similar injuries and similar mechanisms. And so I think it's a very relevant topic, especially for South Florida.
Yeah, absolutely. Like you said, a lot of these sports, golf, tennis, baseball, it all really applies to that. Being in South Florida, we also see a big problem with year-round activities because the weather's good, and so it seems to be an issue as well. But if you were having that conversation with a parent, which I know you do quite often, what are some of the biggest concerns you're having that are causing these injuries, and then what can a parent do or the athlete to try to prevent them?
Well, I think, if you look at especially the pitchers, and I think when you're talking shoulder and elbow injuries, we're going to see mostly pitchers, but not just them. Position players, catchers have these injuries. But if you take pitchers per se, you're looking at probably 80 to 85% of the injuries are what we call overuse injuries. There are certainly those that have acute injuries where one throw did it all. But we know in our field that it's probably something that was building up to that one event. But most of the time they can't remember that event, and it's something that builds up. So these overuse, overthrowing phenomenon is what's causing the problems.
What are your thoughts on I've read a lot of articles recently, and there's been a lot of publicity about it. Two things, I guess. One is the year-round, and also the early specialization of some of these athletes. Do you see any of that as a potential problem for the injuries?
Absolutely. I think the Orthopedic Sports Medicine Academy and the like are really trying to get the message out that sports specialization at a young age is probably not healthy and not the way to go. And when we say by specialization, we mean only being a baseball player year-round. And if you look at the professional levels, those that have made it there, most of them were 2 or 3 sport athletes. And somehow that got forgotten along the way. I don't know why that happened. Pressure from outside, maybe. But to give your body a rest, so if you're a baseball player 6 months out of the year and a soccer player 4 months out of the year, that 4 months is allowing your shoulder and elbow to rest. But you're still conditioning, you're staying in shape, and you're developing other skills that you could also use in baseball. And I think that has gotten lost somewhere in the message for us. Excuse me.
We got a little bit of a TV break. Just to kind of touch on that too, we're definitely seeing a lot of pressure from these year-round leagues, causing a lot of the year-round throwing and not enough rest. I mean, even the professional athletes have off seasons, and so that's one of the things to consider is that if a professional has an off season, the youth should have one as well. So I think that's something to consider as a parent also. So kind of moving forward a little bit, what are some of the most common injuries you are seeing in these pitchers and throwers with baseball?
Well, if you take the elbow, certainly the one that gets the most press is the ulnar collateral ligament injury, the elbow ligament on the inside. The procedure to fix that certainly has been known as the Tommy John procedure because Tommy John was the first person that we know of that had the surgery to correct it. And so in the elbow, that's sort of the dreaded injury that we see in pitchers, sometimes catchers, and maybe some position players occasionally. In the shoulder, certainly tendonitis-like symptoms are what they present with, but there's usually an underlying bigger problem in a lot of those pitchers and throwers of instability. Instability caused by throwing, laxity, looseness of their shoulder, and usually secondary tendonitis. And they develop sometimes bone spurs, arthritis, especially in the elbow. There are things called OCD or osteochondritis, where they're already wearing out the cartilage in their elbow at age 13. So the overuse phenomenon, and really even at a young age, the elbow and shoulder wasn't made to throw a baseball. The degrees per second of motion in the shoulder and elbow is really putting forces above what the structures of the elbow really can take, and it relies on muscular control and contraction to prevent the damage, but it doesn't always work.
Yeah, it seems like that's happening more often. Within the shoulder, are you seeing also some damage to the rotator cuff and the labrum that ends up needing surgery a lot in the high school athlete, the youth athlete?
Sure, the labrum, which is the lining of the joint where the capsule and the ligaments attach, we're seeing labral tears in the adolescent population and the high school population. Certainly labral tears come to us on MRI often, and we're still often treating them non-surgically. The labrum is a very important structure, and it's really very individual who needs an operation for that. But yeah, there are many baseball players that were repairing their labrum.
Okay. And then what are some of the tips you would have for the baseball player or the parent on preventing some of these injuries, whether it is reduction in play or just other aspects that they can do to prevent it?
Well, the research clearly shows that the children that are more likely to get injured are the higher velocity at a young age, the higher pitch counts at a young age, the lack of rest in between throwing, and throwing with arm fatigue. Not using a radar gun per se early on, and especially in a pitcher's career, focusing more on fastballs to be accurate with good control and good biomechanics, as opposed to trying to beat the speed gun. Developing a good changeup at a young age, and sticking to those two pitches early on, and following the Little League guidelines, the USA Baseball guidelines, and they're all published online, of pitch counts and rest between days of pitching. And really trying to avoid what we're really seeing in South Florida is the multiple teams, playing multiple positions or pitching for multiple teams, and then the year round. And really, you've got to find a 3+ month period per year of no overhead throwing whatsoever. And the other phenomenon also that's been occurring is the showcases, and the showcases that pop up sometimes at the wrong time. Kids are throwing with pain at showcases and leading to trouble. And I think also another thing is that when kids throw with arm fatigue, they may not have pain, but we know that there's an increased incidence of true injury when kids throw when they're fatigued. And the parents can look for that. And how do you know? Their accuracy is off, maybe they look like their speed is lower, and even just something as simple as they're taking a lot more time in between pitches. And even just as a fan, the parents or the coaches can see that, because a lot of kids, they won't admit it. They're not going to admit they're tired. They don't want to come out of the game, but that's when injury occurs. Yeah,
and it seems like communication's always a big thing too, with the parent, with the kid, with the coaches and stuff like that. And like you said, a lot of these athletes are, they're pretty driven, competitive athletes. So them saying that they're fatigued doesn't happen all the time. So you definitely have to keep a keen eye on that. And that's very, very good advice. And I'll make sure in the comment section to put those URLs for the resources on some of the pitching guidelines. Right. I think every parent that's got a child that's playing baseball or a teenager should look at that to make sure they understand it. So thank you for that information. And so to kind of wrap it up, what are some of the signs and symptoms that they should look out for with arm issues with the baseball player, and then when should they seek the consultation of a specialist to rule out or rule in some things that might be going on?
Well, I'll answer that last question first. I think that if you're a serious baseball player, let's say, no matter what age, I think you should always, if there's arm pain, and the studies have shown that a high percentage of kids who come to the doctor with arm pain as a thrower, pathology is found. Something is showing up. So I don't think arm pain should be ignored. I think that realistically, if it appears for a couple hours and goes away in a day, then you probably don't need to see a specialist. But something that lingers beyond several days or really affects function, when we catch these things early, we can make a huge difference, both you and I, in the life of these kids' arms for whatever sport they choose. And so for prevention, it's really listening to your arm, watching your kids throw, understanding swelling, understanding the signs and symptoms of a problem, recognizing it, not playing for 2 or 3 teams at the same time, and really trying to rest, trying to find that off season that the major leaguers get, but the young kids don't seem to be afforded that luxury.
Yeah, that's what the crazy part about it. These are fully developed men in Major League Baseball that get plenty of rest throughout the year. I mean, obviously they get a lot of overuse because they play a lot more games, but they get a rest, and then for some reason our kids aren't. So it's
yeah, I mean, we think the Tommy John surgery epidemic in the majors, which is really high, is because of what they were doing as youth. I think that these kids who made it built up injury to that ligament, and eventually it gave at the higher level. But the number of reconstructions of the elbow happening in 12, 13, and 14-year-olds is reaching a level that is extremely alarming.
It is alarming, and then there's so many stories of like the really promising pitcher that makes it to college or even makes it to minor leagues, single A, double A, and all of a sudden throws the arm out and really never has a career after that, and it really could have been prevented early on. And now I think we're starting to understand it more. It's just about applying it and actually following the guidelines and seeking the advice of some specialists when needed, and really being cautious with it, almost to the point of overly cautious, and don't give in to the peer pressure of having to go to the showcase if there's a problem with the arm, or pitching through it if it's a big game and stuff. So I think that's great advice for them, and I appreciate that. And I know we could probably go on for about an hour with this. I don't want to take up much more of your lunch break, and I really appreciate that. Just let them know how they can find you if they have any more questions or they need a consultation, even if it's something outside of the shoulder, some of the specialties that you do. Let them know.
Yeah, we take care of really all joints in the practice. I do arthroscopy of the shoulder, elbow, hip arthroscopy, knee arthroscopy. Certainly non-surgical management, just like yourself, is most of what we do. My office number, you can see on Facebook, is 561-417-3339, and HerschMD.com is a website that you can go on, learn more about me, make an appointment online, and come see us. And Dr. Christie and I work together. We're right around the corner from each other, and we have over the years of our over 10-year friendship, I have a lot of athletes that we bounce back and forth, because really, even if I do a surgery, really my success is what you guys do in the therapy clinic is going to make or break that athlete.
Yeah, and a lot of times sometimes they'll come to me first for certain things. Maybe I have a connection with that parent or that athlete. And I always say, I know enough to know what I don't know, and then I usually get them out if it's something that's alarming. And like you said, with baseball and the pain, that's lasting a little bit. It's definitely time to get it to a specialist and stuff. So, perfect. Thank you very much. Appreciate it.
Good to see you.
Yep.